All right, guys, so I have the scans pulled up that are located in your Research and Helpful Links Module 6 tab. So I have these 4 links up here: peritonsillar abscess, lingual thyroid, parotid sialadenitis, and parotid lipoma. So different scans we're going to reference. We'll start with the peritonsillar abscess in the sagittal view. Okay, so I'm in a sagittal plane here. Center it better. And then we're going to talk about the pharynx. So first we'll talk about the pharynx. Let me get in a good mid-sagittal plane here. So we have the pharynx, which is approximately 12 to 13 centimeters long, beginning at the base of the skull. So here's base of the skull right here. Draw a line across. This is going to be the superior portion of the pharynx, and then the most inferior portion is going to be where it becomes the esophagus. So down here, right around this area, is where the esophagus begins. This is the piriform sinus right here. So this is where the esophagus begins, posterior to the trachea. Okay, so from about here to about here, this is all your pharynx. Remember, the pharynx is divided into 3 separate sections: the nasopharynx, the most superior, the oropharynx, the middle, and then the laryngopharynx, the most inferior. So let's start with the nasopharynx. First thing you want to see are the nasal concha or conchae right here, the clivus, which is right here. This is the anterior portion of C1, odontoid process here. So we have the borders, the posterior borders of the nasopharynx are the clivus, the anterior of the C-spine, the superior portion of the uvula on the soft palate. So this right here is hard palate, actual bone, and this here down to about here is your soft palate, okay? And this little guy here coming anteriorly, that's a little slice of the uvula. The problem with this sagittal study is it's kind of thick slices, so we're not really seeing a good picture of the uvula. But when we know our anatomy, we know that we have hard palate, soft palate, and this little portion coming off the soft palate is the uvula that hangs down in the back of the throat, which we could tell this is the mouth right here, this is the back of the throat, tongue. This is tongue right here. Okay, so here's your uvula. So the soft palate, the superior portion of the uvula, over to the clivus and the anterior C-spine, nasal concha up here. That is your nasopharynx, this whole area here, okay? The pharyngeal tonsils, otherwise known as the adenoids, those puppies are right here. Okay, so those are your adenoids or your pharyngeal tonsils, okay? Next we have the eustachian tube openings, which is this study. You can see it on, yes, I believe this. So see this little dot here and this dot here. So remember that the eustachian tube opening is in the nasopharynx. They are posterior and laterally and then travel up. So this is one slice, we're seeing it on end. And then here it's traveling up and exterior, laterally out towards the ear. So there's your eustachian tube, okay? You can't see it on the other side. It's not, just the slices are too thick. We can't quite see it. But you can see just the one section here and then the next slice laterally there of the eustachian tubes. They're posterior and inferior to the nasal concha, which you can see here. And then there's your opening. Next, we're going to move down to our oropharynx and the borders of the oropharynx. The superior border begins at the uvula or the soft palate, which we've already decided is here. So we can draw this imaginary line here. That is the superior border of the oropharynx. And then the inferior border ends at the level of the hyoid. And here's your hyoid right here. Okay, your hyoid bone. So from here to here, this whole area is your oropharynx. And the oropharynx includes the lingual tonsils, which are at the very back and base of the tongue, which you can't quite see here. But you can see the palatine tonsils, the tonsils that you can see at the back of your throat. They're hanging right here, okay, on both sides. There's one and there's the other, okay? So there's your tonsils, your palatine tonsils. The other thing that we need to look for in the sagittal plane in the oropharynx is the epiglottis right here. And then the little pouch that collects food or foreign bodies and prevents them from entering into the trachea is the vallecula. And here's the vallecula right here in a sagittal view. This pouch right here, just anterior to the epiglottis. Okay, remember the epiglottis during swallowing folds back this way. So it'll fold right down, close over the opening of the trachea, and allow food to go right down the oropharynx, down into the esophagus, posterior to the trachea. Okay, so that is the oropharynx. And then the next thing we need to look at, the next section, is the laryngopharynx, which starts at the inferior portion of the hyoid. So here's your hyoid bone right here, across. And it goes down to the entrance to the larynx and the esophagus. This is the entrance to the larynx right here. And then this is the entrance to the esophagus right there, around this level. So this little area here is the laryngopharynx. Laryngopharynx. And this area includes the piriform sinuses, which, remember, those are two other posterior pouches or depressions that help divert food away from this area and down this area. So here's your piriform sinuses on both sides. Okay? So those are your three segments of your pharynx. Let's switch to a different view. Let's go to coronal. Now, it's going to be a lot harder to see the distinction between the different segments of the pharynx, but what I do want you to be able to see in this view, in a coronal view, are the nasal concha, which you can see here. This is clivus here. You should be able to see that. The uvula, you can't quite see. There's a little speck of it right there. What I do want you to be able to see is when we go anterior, these two little pouches here and here are your vallecula. Okay, that's your vallecula. This is trachea here. And then as we travel posterior or towards the back, you're going to have these two bigger pouches. Those are your piriform sinuses. And then this is your epiglottis. Okay, epiglottis attaches anteriorly right here. And as we travel posterior, there it is. And remember, it's going to flap backwards to close off the opening to the trachea. So though that's in a coronal view, the other thing I want to point out to you, which this is going to help you to also find the cartilages in a different view when we talk about the cartilages of the neck. The piriform sinuses, when you locate the piriform sinuses, which are pretty easy to see, I mean, they're these big, long pockets. There's really not anyone you're going to be able to see them on. You might have difficulty seeing the vallecula here, but piriform sinuses you should have no problem seeing. So once you visualize the piriform sinus and you go like 1 or 2 slices posterior, you're going to see these two little folds, and that's the aryepiglottic fold, okay? And that's going to come into play when we're looking for the cartilages that make up the windpipe or the vocal cords. So false and true vocal cords are in this area. So when you're trying to find those cartilages, look for your piriform sinuses, look for the aryepiglottic folds, and then that will help you to nail down where the cartilages are in the neck. Now, this is not a good study to see the cartilages. You can see the hyoid bone clearly right here. However, you're not really seeing the thyroid, cricoid, or arytenoid cartilages, which are the 3 cartilages that you should be able to see in the soft tissue neck. So that's your coronal view. Let's switch to an axial and do the same thing. So we'll start, well, this one doesn't do axial. We'll switch over to a different study. Let's switch over to, let me look at this quickly. Yeah, let's switch to this one quick. So this is an axial view. Let's start up to the top. Let's go all the way to the top and go down. Okay, we have traveling down your nasal concha. In here, nasal concha coming down. We're going to get hard palate and then soft palate. And then we're going to look in this area for like a little guy sticking out. That's your uvula sticking down into the back of the throat. It's attaching here, coming down. There's your uvula. Okay, so if we're at uvula here, we know that this is the start of the oropharynx. So everything above this is your nasopharynx down until we hit soft palate and uvula. Okay, so everything above this area, nasopharynx, we get to uvula. Everything below this area is now going to be oropharynx until I hit the hyoid bone. Okay, so uvula. So as we travel down, we're now into the back of the throat. This is the back, just behind the uvula. The next thing we should be looking for is epiglottis. And here's your epiglottis right here. It's coming in. When you see the epiglottis, the two round pouch-like structures anterior to the epiglottis are your vallecula. Okay, they're anterior to the epiglottis. And as we continue down, we're going to now look posterior for our piriform sinuses. So epiglottis still here, coming down, coming down, coming down. Oh, sorry, I went the wrong way. Coming down, coming down. There were your piriform sinuses here. Okay, so not as easy to see on this guy, but when you see the epiglottis, the two openings or pouches anterior are going to be vallecula. The two posterior are going to be piriform sinus. Okay? Down into the trachea. So when you get to the level, as we're coming down, the level of hyoid, which is right here. So we now are at right here, we have exited the oropharynx and we're entering the laryngopharynx. And then the laryngopharynx is going to travel down to the opening of the larynx and the esophagus, which remember esophagus is behind trachea, so it's back here, but this doesn't go down low enough for us to see. Okay, so those are your, and that's that in axial view. Let's look for, let's do it again in axial in a different study. So here, let's start all the way at the top, going down. Here's your nasal concha. Next, we're going to look for hard palate. Here's your hard palate coming in and your soft palate behind it. So the structure at the back is going to be your uvula, which we're not quite seeing on this guy. The uvula is probably hanging, it's in here, it's probably hanging close. So as we come down, we now want to look for epiglottis, which here's epiglottis coming in. So the pouches anterior to that are going to be your vallecula, and then the pouches posterior are going to be your piriform sinuses. Okay, and then as you go down, we now have the glottis, and the reason I know this is the glottis is because this is the opening when the vocal cords are in a relaxed position. All right, and this is a good study to look at the cartilages. So let's go back up and look at hyoid bone. So here's your hyoid bone, really prominent hyoid bone right here. As I travel down, my next density, which you can kind of see this line here and here, that's your thyroid cartilage right here. And remember, thyroid cartilage does not travel all the way around the pharynx. It's only on the anterior portion. It leaves this back third, if you will, open. But the one cartilage that does form a complete circle around here is the cricoid, which is just inferior to the thyroid cartilage. So if I go down, I can see this guy here that's coming around, still coming around, and then it's just kind of, it's really cartilaginous. It's not as thick there. I'm not quite seeing it. So that's your cricoid cartilage, okay? And as I go up, remember those two little hooks that are sitting on top of your cricoid cartilage? That's your arytenoid. Okay, your arytenoid cartilage, the paired cartilages that you can see. You're not going to be able to see the corniculate or the cuneiform. They're just too small. You may see them on a real detailed MRI, but you're not going to see them on a CAT scan. So those are your cartilages. Okay, and the opening, remember the glottis is the opening created by the relaxed vocal cords during just relaxation, not during phonation. When we have phonation, these are closed, these vocal cords, which are in here. You can't quite make them out, but I know they're here because they're attached to the arytenoid cartilage and then anteriorly to the thyroid cartilage, which I can just make out here. So when they are closed and not in a relaxed position, remember these come together, pushing these two vocal cords in together, creating just a tiny slit here. So when the air passes through, it makes a noise. Right? So those are your vocal cords are in here, which I wouldn't have you identify them, but you should know where they are because you know that they attach to the arytenoid cartilage, which sits on top of the cricoid. And this is the cricoid here that travels all the way around, just inferior to the thyroid, which is just inferior to the hyoid bone. Okay, so those are, that's that. What else do we have to talk about? Let's switch over and look at a sagittal view. I'm sorry, this is coronal, a coronal view. Same thing, nasal concha coming down. Yeah, I don't see uvula on this guy, but I do see vallecula here. Here's your epiglottis here. You're not quite seeing the whole kind of pyramid, but then the next two lateral pouches here, your piriform sinuses. These are your aryepiglottic folds right here. Okay, and so now that I know that I'm in this area, let's go back anteriorly and let's look at the cartilage. Okay, so let's look at hyoid bone should come in first. Here's hyoid. Just inferior to that is going to be my thyroid cartilage, which is here. Now anteriorly, it's just kind of like you can barely make out little calcifications of the cartilage in here. Okay, and then as you go down, here's my cricoid coming in down here. Thyroid, thyroid. Posterior, here's my cricoid that has come around to the back. Right here, cricoid, cricoid. And then these little hooks are your arytenoid right here, coming off of the cricoid. Okay, so those are your cartilages in a different view. Sagittal view, we can go over and look. Hyoid bone, here's your thyroid cartilage there. Can't quite see it as well here. This is cricoid coming in the back here. So those are your cartilages, epiglottis, vallecula, piriform sinus back here. Pharyngeal tonsils. Here's your palatine tonsils there. Clivus, hard palate, soft palate. You can't see uvula in this patient. And you can't see uvula because this guy has a parotid lipoma. There's a bunch of swelling in here. All right, so now let's look at, make sure I didn't forget anything. Tonsils, vallecula, epiglottis, piriform sinuses. Let's look at, to go over some glands. We have to go over the parotid glands. So easiest to see in an axial, I probably would only ask you in an axial, and on this patient that has the parotid sialadenitis and the parotid lipoma, and axials are going to be the easiest ones for you to see. So switch over to this one. Let's look at the axial image. The parotid gland, if you look over here on the side of the head, you can see on a normal, here's the normal one, just posterior to the mandibular rami, you have this like grainy glandular tissue over here. This is your parotid. Now see how it looks muscular? It almost looks, this is the, what is this, the masseter muscle over here. You don't need to know that. This is, it looks different. It looks kind of grainy or mushy, I guess, lobular maybe, compared to muscle, which is right next to it. However, this is the parotid gland. Remember, it's going to look meatier than all the other glands we're going to talk about. So parotid gland on the lateral aspect of the mandibular rami. As we go down, it's going to travel down, and then here it goes away as we get down lower into the neck. But when you look at this guy's left parotid, so we'll start back up here. It's starting to come in here. Parotid. This guy has got an issue with his parotid. It's swollen. He has a stone in his Stenson's duct. So the duct on this side, which this is the Stenson's duct right here, emptying into just across from the second molar. Right here, see how it's thickened on this side? So there's a stone down in here that's preventing the saliva from the parotid gland to empty into the mouth on the left side. So we have some backing up and some swelling in the left parotid. So this is all parotid on this side. See how yucky it looks. And this is the fat stranding. This is called fat stranding out in here from that infectious process that's going on. Okay, the next gland we need to look at is the submandibular gland. Submandibular is going to be just medial to the mandibular rami. It's going to look glandular again, and you can kind of see on this side, it's easier to see here. This one is over here. So here's your right, here's your left submandibular. And then up in here, a little bit lower, you're going to kind of see some glandular tissue in here. That's your sublingual glands in here, just under the tongue. Okay, so parotid, the big one, submandibular over here, and sublingual up here. These guys here and these guys here. So those are your glands, your salivary glands. Remember, there's a bunch of little ones we don't have to worry about. Right, so that's that. We can look at this guy, and oh, there's only axial. Let's look at the parotid lipoma in an axial view. So lipoma is this like fatty growth on the parotid gland. So we don't quite have a normal parotid gland over here. Here's parotid gland over here. And this guy, even better, looks like, you can see how it looks totally different than the submandibular gland, which is in here. Where is it? In here. This guy here and this guy here. And then the sublingual, you can see them in here. See, you can even see it even better on here. It looks almost like your textbook where you have the multiple little ducts that are emptying into the, just under the tongue. You can see them. You can follow the track here. So those are your salivary glands. Remember, there's a whole bunch of them, and they each secrete their own chemicals, their own chemical concentrations that perform a very specific function. So that's it for now. We'll pick up next week talking about the thyroid, and then we'll go on to the muscles that you need to know, which are not many, only 3 muscles, and the vascular system in the neck.